Howdy, my name is Franceli Orta, and my presentation is about anterior pelvic tilt found in dancers. So here is just a brief overview of what I'm going to be talking about. So we have the description, causes, impact in the dance world, and my dancer demonstration alongside exercises and conclusions. So what is anterior pelvic tilt? So this refers to the postural condition where the pelvis tilts forward, increasing the arch in the lower back, causing lumbar lordosis. In other words, rather than the posterior superior iliac spine, also known as the PSIS, and the anterior superior iliac spine, the ASIS, being in line with each other laterally, the PSIS is more elevated than the ASIS. Anterior pelvic tilt in dancers may cause tight hip flexors, weak abdominal muscles, or lordosis, which is the inward curvature of the spine, typically in the lower back or the lumbar region or the neck. But in this case, it's mostly in our pelvic lower back area. Anterior pelvic tilt may impact a dancer with their spine and hip compression. This forward tilt can compress joints in the pelvis and lower back, limiting movement and causing tension. This can also reduce the range of motion with the dancer. So compressed joints and tight muscles can restrict a dancer's ability to move freely and efficiently. This may also decrease power and efficiency. So anterior pelvic tilt can weaken core muscles, leading to less efficient use of the standing leg and forcing the gesturing leg to do more work. This may also cause an increase of injury risk. So a weakened core and gluteal muscles can lead to a higher risk of lower back pain and lower extremity injuries. Hello, my name is Franceli Orta, and this is Kelsey. She's going to be my dancer demonstration. We noticed that the PSIS is a little more elevated than our ASIS, and we can tell that our lumbar spine has a little more curvature than usual. So I'm gonna have Kelsey here do a first position plie with her arms in first position. So Kelsey, can you do a plie for me, please? So as you can see, her pelvis is anterior tilting. And so Kelsey, I want you to pretend that you have headlights in your ASIS, and instead of flashing them downwards, I want you to not tuck the pelvis, but shine your lights. So push up. So yes, engage in your abdominals and make sure to have a flat back, and try your plie one last time. And see how she's not anterior tilting as much. So she's engaging more in the abdominals, and she has her hip flexors more stretched out. And so we're gonna work on some exercises that can target these factors, because we know that with anterior tilting, we have tight hip flexors and we need to strengthen our abdominal core. So for our anterior tilt, we need to stretch out our hip flexors because they're so used to being tight all the time. So here we have Kelsey doing a front lunge, really stretching out those hip flexors. There are also many variations on stretching the hip flexors. So here we have a pigeon pose. And if you need a bit more of a stretch, you can lift this back leg and put the knee down and lift it a little more. The goal is to have the hip flexor as close to the floor as possible. Secondly, we have our abdominal phrase that we can really strengthen our abdominals when having anterior tilt. So Kelsey here is going to be doing a set of dead bugs. So all she's gonna do, she's gonna have her knees be aligned with her hips and her ankles aligned with her knees. And Kelsey, I'm gonna have your arms go up in front of you, and with the dead bugs, it's just an alternation of arm and leg. And then come back and switch, and make sure your knees don't go past your hips, just like that. And just continue doing those. This will really engage in not only in your hip flexors and really strengthening them, but you're also going to be engaging a lot in the abdominals, just for that strength. In this position as well, you have your lordotic curvature more alleviated, and due to the fact that you have your knees up. What we want to avoid is a static position such as a plank. You always want to be having a dynamic exercise. Because of this, we have more stress on that lordotic curve, which is only going to make that anterior tilt more prominent, and that's the opposite of what we want. In conclusion, some things to think about. In some cases, surgery may be necessary to correct a severe anterior pelvic tilt, but in some dancers, that's not really that necessary. It's important to consult with a healthcare professional before starting any new exercise program, especially if you're having underlying medical conditions. Anterior pelvic tilt can be a common postural issue, but is not always a cause for concern. With proper treatment and lifestyle modifications, most people can improve their posture and reduce symptoms. Thank you so much, and that was my presentation on anterior pelvic tilt in dancers. Thank you.